what I'd like to talk about is how we can use robotic systems, and sometimes tele-robotic systems that are comprised of two robots for performing tele-assessment or tele-rehabilitation of either disability or injury. And it just happens to be very appropriate for the challenges that COVID is posing. So I don't need to talk about population aging. You know, it's just the fact is that the rate of fertility was very high at some point in the past, and then there has been a sharp drop in the rate of fertility in most countries, and this has resulted in what we call baby boomers, basically an old population existing now because of the high fertility rate at the previous period, and then the kind of drop in the number of children per woman. 2020 is the first year in recorded history where the number of people over the age of 65 is more than the number of people under the age of 5. And so this is causing a number of issues. The aging of the population has resulted in an increase in the prevalence of physical injuries. For instance, injuries resulting from falls, in mobility impairments, and in neurological disabilities. So what I'm going to focus is how we can use robotic systems to reduce the burden on the healthcare system that is caused by the population aging. Now, at the same time, we are also dealing with COVID, and robots can help to alleviate the burden placed by COVID at the same time. So robots can be used for combating COVID-19. For instance, they can reduce contact times between patients and frontline health workers. If you enable telepresence-based solutions so that you can do, for instance, remote screening or curbside screening of patients before they come into the hospital, or screening of patients and triage of patients in ICU or in other hospital rooms remotely. Robots can reduce the rate of cross-infection between healthcare workers, again, by creating this distance. They can allow for remote patient evaluation, monitoring, and intervention. And because of this increased distance that robots provide, there is less need for protective personal equipment. And this was primarily very important at the beginning of the pandemic. And, for people who are in isolation, robots can also help with physical and mental rehabilitation. If you're interested, you can read this paper that we wrote back in April or March about how robotic systems can actually aid COVID-19. Now, I would like to show two videos that are not related to rehabilitation, but just want to emphasize what robots can do. So what you see on the top left is two robotic systems allowing for remote ultrasound scanning of a patient who is at the remote site. So you have two robotic systems, and then there's a telemanipulation system that allows for doing a particular operation remotely and over a distance. So this is telehealth, this is telemedicine, or tele-assessment. The other possibility is what's shown on the bottom right. This is a distancing-aware healthcare service delivery. So in this situation, we are not necessarily doing things over a long distance. It's just 2-meter distance or so created between the patient and the healthcare staff, so that the risk of infection is reduced and the requirements of PPE and all of that are also reduced. So I would like to talk about these two, telehealth and also distancing-aware healthcare delivery, as they relate to rehabilitation. So in the paper that I mentioned, we talk about how different categories of robotic systems can be used for serving patients in different spectrum, in different parts of the care spectrum. And the part that I'm going to talk about, rehabilitation and assistive technology, is part of that. So why do we require robots for rehabilitation. As you know, rehabilitation is facilitated by having a patient practice repetitive exercises. So as you see, for instance, in the top right, the physiotherapist is helping the patient with assistive or resistive therapies. This is hands-on guidance, and it's very burdensome and physically demanding for therapists. Now, robots have been used, as you see on the bottom right, to alleviate this burden on physiotherapists. The good thing with robotic systems is that they do not fatigue and they have high accuracy. However, as you see here, robots basically bypass the therapist. There is nothing left for the therapist to do, and robots do not really add anything to what a physiotherapist is already capable of doing. So there is no added feature being offered by the robotic system, and there is no direct involvement of the therapist when robots are used for physiotherapy. So that's the issue that I'd like to talk about. The other issue is that robots are pre-programmed and provide very simple interactions that are appropriate only for predefined tasks. These tasks cannot be personalized. So for instance, what you see on the bottom right is for the case of point-to-point movement, and there is a game that the robot helps the patient perform. There is no opportunity for personalization, and I'd like to talk about how these can be addressed. So the first goal of my talk is how do we re-engage therapists and extend their reach via tele-rehabilitation. So the goal is to enable therapists to physically interact with patients who are possibly located remotely using robotics and virtual reality. So if you consider traditional rehabilitation, there is hand-over-hand assistance or resistance rehabilitation provided by the physiotherapist to the patient. If you consider a robotic system, the patient only interacts with the robot and there is no involvement from the therapist. How do we combine them so that we still benefit from therapist skills and at the same time we make use of the capabilities of robotic systems and fuse them to have best of both worlds? So that's the goal. And to do this, we are going to move away from one robot for the patient. We are going to go to the case of one robot for the patient and one robot for the therapist. And these two robots are haptically or kinesthetically linked to each other, meaning that they mimic each other's movements. So this way, the therapist is in the loop, and tele-rehabilitation is possible because the only connection between these two robotic systems is through internet. So we keep the therapist in the loop. We take advantage of the knowledge and training of the therapist. The therapist can interact directly with the patient, can even do assessment remotely because every motion of the patient side robot is transferred and mimicked by the therapist side robot. Also, the therapist can intervene and modify the therapy in real time. And there are also other benefits such as power amplification, so that a little bit of force applied by the therapist is translated to a lot of force applied by the patient side robot to the patient's body. So this is kind of a block diagram of how this system works. There is a user interface for the patient. There is a user interface or a robot for the therapist. There is a shared virtual environment which you can have two copies of, one on the patient side and one on the therapist side. And there is a game that they play together, sort of similar to what Craig was talking about, two users playing an online game. The same thing can happen here. So the patient starts a move, and this results in the motion of the cursor and some action in the gaming environment. And then the therapist reacts to that motion, and that results in application of a force against the patient's hand. In this way, we are emulating hand-over-hand therapy that you traditionally have over a long distance. So with this, we have done things like assistive or resistive tele-robotic rehabilitation. There is sort of an elastic band between the cursor of the patient and the cursor of the therapist. And depending on whether the patient is leading the motion of the therapist or lagging behind the motion of the therapist, you can have assistive or resistive therapies. And this could also be done over a long distance. Again, you can have 2 copies of this virtual environment. And so you could either have distancing aware rehabilitation, or you can have completely tele-rehabilitation for the case of when, for instance, the patient is at home. One of the issues here is when there is time delay between the patient side robot and the therapist side robot because of the long distance, then there are issues with the stability of these systems, and we've worked on addressing those issues. The target motion could be more than a point-to-point motion. For instance, what is shown here, there is a circle that a target point moves on, and the patient tries to follow that point, tracking that point on a circle. The therapist can intervene and assist the patient in following that point or resist the patient's movements as appropriate. Just the point is that all different sort of reaching movements are possible using such a system. The second objective of the research is facilitating personalized therapy, and in the meantime, reducing the workload of therapists. So what we are going to do is understand the therapy that the physiotherapist provides for a patient. So that's going to be patient-specific therapy, capturing that using artificial intelligence, and then replaying that for the patient using a robotic system, so that the patient has more chances of doing that exercise and receiving a higher dose of therapy without basically tying up the therapist, so that the therapist can pay attention to another patient. This is a point that Nizam also brought up, that if we can enable a clinician to work with more than one patient and use the clinician's time more efficiently, that's going to be an advantage, and that's what these telehealth systems can offer. So as you may know, it's very important to incorporate activities of daily living, such as the ones showing this picture, in the rehabilitation program. Basically, if a patient tries reaching movements, it does not necessarily translate into being able to also perform the actions that are shown here as examples. For best efficiency and for best patient independence and quality of life after rehabilitation, it's best if these activities of daily living are directly incorporated into the rehabilitation program. The issue is activities of daily living are performed in highly unstructured environment. For instance, if you want to teach a robot, help a patient perform a door opening task, the immediate question is, what kind of a door is it? What kind of a knob does the door have? What is the range of motion? Is it a sliding motion, or is it a hinged rotary motion? And all sort of those questions. So there are no 2 doors that are similar to each other. And therefore, it's very difficult for a robotic system to learn how to deal with all doors in the world. The nice thing is that humans can robustly perform these activities of daily living. Therefore, the idea here is to use artificial intelligence to capture how a human, an able-bodied human, performs a task, and then let the robot learn that behavior from the demonstration of a human and produce that behavior in an assistive manner for a patient who can't perform that function independently. So this is the area of learning from demonstration, which is an area of machine learning and artificial intelligence. Basically, we want to encapsulate the therapist's intervention and expertise through an analytical model or through AI more recently, and enable semi-autonomous patient-specific robotic intervention in future iterations of the same task. So there's going to be a demonstration phase where, for instance, a therapist collaborates with the patient to open a door, and the robotic system understands what was that the therapist was doing and reproduces that behavior in the second phase when the therapist is away and attending to some other patient. So that's the idea of learning from demonstration. Let me show you a couple of videos, and hopefully that then makes sense. So in the top right, we have a person who has to perform this activity of daily living of opening this drawer, but he can't do it because of the disability. The robot here is just in listening mode or observing mode. In the second iteration, as the patient is doing the task, a therapist comes from the back and assists the patient. So now the robotic system has seen what the patient alone can do and what the patient plus therapist do together, and subtracts them and performs in future iterations what the therapist did in the second iteration, so that the patient has more opportunities for doing these exercises. In the other video at the bottom, this person, of course, all of these are simulated patients, has a problem with toe clearance, but wants to do treadmill training. As you see here, a robotic system is being moved by the physiotherapist, lifting the left side of the patients up at the correct time of the gait cycle. And then just based on data, and without really knowing what the task is, the robotic system can capture that behavior that was delivered by the therapist in one iteration or a few iterations, and then deliver that in future iterations so that the patient can walk, let's say, for half an hour or an hour without the therapist necessarily being there. If the patient comes back in another day, or if there's another patient, you will have to retrain the system, but that training does not take much time. It's just a few short minutes, and then the patient can continue the task. Together with Dr. Kim Adams, we have applied a similar idea to children with disabilities. So for children, it's very important for engagement purposes to be able to perform playful activities and be successful in them. So for this hot wire game, if a child is unable to perform the task, a helper, for instance, a parent or a sibling, can come in and show the robotic system how to assist the child in 1 or 2 or 3 iterations, and then future iterations are helped. The child is helped directly by the robotic system. So that's what you see in experiments that we have done with a simulated patient and with someone who actually has a disability. So the task cannot be done. This is a 2-degree of, or a planar hot wire game. And then a helper comes in, they perform the task together. And then later, in the absence of the helper, the user will be able to perform the task successfully. You can also do the same thing through a distance using a teleoperation system. So I'll quickly show you a couple of videos. What you see on the top left, there is a simulated patient in the foreground and a simulated therapist in the background. They are together and through a tele-robotic system lifting a bar, like lifting a box from the 2 sides of it. And then once the therapist demonstrates this behavior to the robotic system, the patient side robot basically replaces the intervention given by the therapist. Because we are kind of running out of time, I'll quickly just cover the last topic, and that's how do we create engaging and immersive therapy environments so that therapy is not only fun, it's also meaningful using robotic systems and augmented reality. So what we have done is we have used the robotic system and an augmented reality display so that much like how a flight simulator simulates the dynamics of an aircraft and also creates a visualization of what the pilot sees from the cabin, a task is simulated both haptically and visually for the user. So for instance, for the case of painting a wall, and this is the work that we have done together with Doug, from the perspective of this user, there is a 3D wall being rendered using augmented reality, and that wall is also being felt haptically. And you can basically, instead of having physical environments, you can simulate as many virtual environments as you want. And some of the examples of tasks that we will be working on in the future to simulate using this system are shown here. So this can be combined with learning from demonstration and also with telehealth in the future.